What does it feel like to be someone addicted to opiates? Imagine being called names, having to lie to your friends, family, and your doctor. Imagine the stigma. And to wonder that if you die, will anyone care? Or will you wake up in the hospital being the laughingstock of the news? Where were all the friends that surrounded you before? What are they saying about you? Do they know you're alive? Your relationships, friendships, family bonds, your children, stripped away from you because of this disorder you've never asked for. It's no wonder why depression hits so hard in opiate addiction. Addiction corners all who it afflicts and makes you do things you would never think you would do. It seeks to imprison you. Or worse. Just imagine. Over the years, courageous pioneers have begun to be the voice of those who haven't been able to speak for themselves. And they remind us that we in the ER are the front line for the opiate crisis and maybe the only medical professionals whom those afflicted with opiate addiction will ever see. Since the year 2000, we've known that buprenorphine, the active medication in Suboxone, has been an extremely effective weapon against drug addiction, blocking the urge to use opiates and reducing the chance of an overdose. We've also known that starting sublingual buprenorphine in the ER significantly increases the chance the patient will successfully make it to outpatient therapy. But lack of insurance, prescription costs, lack of waivered medical providers, and lack of transportation can, once again, make the road to recovery difficult. We may have a solution for this. Our emergency room has the honor and privilege of being selected as one of the 30 centers across the nation to evaluate the effectiveness of a brand new injectable medication, CAM2038. CAM2038 is a buprenorphine depot shot given in the emergency room before the patient is discharged, and its positive effect on addiction can be seen over a week with just one dose, providing a tool against opiate abuse and cravings long enough to see a behavioral specialist. The depot effect also reduces the unpredictable medication levels in the bloodstream, eliminating opiate withdrawal symptoms seen between traditional sublingual doses. Coming soon this year, eligible patients in our emergency room will be randomized to either Suboxone, the brand name of the sublingual buprenorphine and naloxone, or the injectable buprenorphine known as CAM2038. We will be evaluating their outpatient follow-up for successful therapy follow-up, relapse, and overdose numbers. For some patients, our encounter with them in the emergency room may be the only time we will ever see them, or worse, the last time. For some patients, they can only imagine what it's like to be free from the chains of addiction. Many can only imagine what it's like to have their life and their loved ones back in their arms again. And few can only imagine that they would get this help from a stranger. Thank you for all the endless hours you sacrifice to help others. Your selflessness is what makes Berkeley Medical Center stand out.